3.
Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go through a few stretches that you can do if you have suspected shin splints. The best thing you can do when you have shin splints, because shin splints are caused by a muscle imbalance in your leg. It's not just pain in the shin, it's weakness elsewhere and tightness elsewhere. So you want to make sure that you are supplementing these stretches with a good foam rolling program. We have another video on our YouTube channel on how to foam roll the lower leg. So if you reference that, you should be doing that about 10 minutes every day. Just treating the shin splints or just stretching the shin splints or just doing compression or rolling out the shins is only going to provide a temporary fix. It's not going to fix the entire situation. So you want to make sure that you're concentrating on the whole leg when you're looking at shin splints. The first stretch you're going to do is a gastroc stretch. This is going to stretch the back of the leg. So you're going to just start in standing, put the leg behind. You want to make sure that the heel is down and that this leg is straight. You're going to hold that for 30 seconds and you're going to do 6 of them. It's best to do this on both sides. That one shouldn't cause you any pain or discomfort. The main point is to keep the heel down in the back. The next stretch you're going to do is the Piriformis Stretch. There are a number of ways you can do this. We're going to show it to you in sitting. The Piriformis Stretch is important because it gets the entire lower back, it gets your glutes, it gets your IT band, and it even gets a little bit of your adductors. So you want to make sure that everything up top is loose so it's not pulling on the muscles in the bottom of your leg. You want to start by crossing your ankle over your knee. Sit up nice and straight. If you feel a stretch there, you don't need to move any further. Hold it there 30 seconds, 6 times. If you don't feel a stretch there, you want to hinge forward at the hips until you feel a stretch. You want to hold that 30 seconds and you want to do that 6 times. If you feel pain, back off the stretch a little bit and still hold it for 30 seconds, 6 times. You can do this numerous times throughout the day as you're sitting at your desk. Then you're going to finally do the shin splint stretch or the Tib Anterior Stretch. You're going to slip off your shoe. You're going to stretch the front part of your foot by curling your toes under and holding it 30 seconds, 6 times. You should feel a stretch coming up the front of your foot and into your shin. If this is too painful, back off the stretch a little bit and don't push your toes so far under. You want to try and do this stretch because it is the most beneficial, but if it's causing you too much pain, discontinue it until a point where you feel you can stretch it out. If you think you have shin splints or need further advice, please call us at 215-997-9898.